Hi, this is Dr. Satish Pawar, Chief Surgical Oncologist, Care Hospitals, Hyderabad. Today, let us talk about nutrition and diet in cancer patients. So, that's a common myth, especially in our Indian patients, that especially after taking any form of cancer treatment or after surgery, that this should not be eaten, that should not be eaten. So, today let me clarify few things, few myths about cancer treatment and the nutrition associated with it or the diet associated with it. Basically, cancer patients will have patients who is undergoing radiation therapy, especially for the head and neck cancers, where we do surgery and then patient takes radiation, or there is completely radiation for about 2 months of treatment, where radiation is the only treatment for the cancer therapy along with chemotherapy. In these patients especially, they will not be able to take adequate orally, because that part is being radiated, or that part, the radiation is received in the region of the mouth and the throat. So, in these patients especially, they should be hydrated. That means the water intake should be adequate, and any form of liquid without much spice, without adding the spices, give it a bland food, give more of fruit juices, give more of milk products and such as curd or milk or juices, and then keep try to meet the nutrition of the patient. Along with that, we have protein powders which the patient has to be adequately taken. So, this is the patient who can take adequately by their own mouth. Otherwise, you should always inform your radiation oncologist, the doctor who is giving radiation, that the patient is not taking adequately. Then there is something called a Ryle's tube, or a nasogastric tube, which is put through the nose, and the nutrition can be given through the nose. Or there is something called a PEG, where a tube is introduced through an endoscope into the stomach, and we can maintain whatever the nutrition, the kitchen feeds, the protein powders, all can be given through these tubes, so that the basic aim is to complete the treatment in the adequate time, and nutrition has to be maintained. This is regarding patients who take radiation. Patients who take chemotherapy will have they will have loss of appetite. That means they will develop aversion to food. They will not like, there will be distaste. That means they will not enjoy the taste of the food. That is why they will try and avoid any type of food. So, in those patients especially, adequate nutrition has to be maintained in the form of taking adequate amount of carbohydrate, adequate amount of protein. So, in these patients also, having liquids such as juices, milk and milk products, and adding the way we give to smaller children, we should break the diet into smaller meals and give them. If a normal person is having 3 meals a day, these patients we need to give at least 6 to 8 times, and every 2 hours we should give something to these patients, so that we are able to maintain their weight and maintain the nutrition to take the treatment properly in time. About surgery, there are a lot of myths in our country, especially about the surgery, that we shouldn't have rice. So, basically people who belong to the southern states feel that they shouldn't have rice, they shouldn't have dals, pulses, which will cause pus in the wound, which is a completely wrong concept, and there is nothing of this sort in allopathic medicine saying that this should be eaten and this shouldn't be eaten. Yes, oily foods, more spicy food should definitely be avoided, but anything, and you should always think of supplementing any proper diet. In that you should have proper foods, proper fruits and proper boiled vegetables, green leafy vegetables, so that the nutrition is maintained and patient are not prone for more infections and gut related infections. So this is the main important thing, and apart from this there are a lot of myths saying that sugar, whatever the sugar intake you take will go to the cancer cells and the cancer cell it feeds the cancer. This is also a wrong myth. So according to the guidelines, according to the research, the amount of sugar intake should be, there are recommended guidelines that daily intake of at least 37 to 40 grams of sugar can be absolutely safely taken, not only for cancer patients, even for reducing the risk of cardiovascular, that means reducing the risk of stroke and heart attacks. So less than 5% of your carbohydrate should be sugar. So there is there is evidence for reducing even the artificial sweeteners. Instead of sugar and jaggery, if you replace it with artificial sweetness, that also causes increase in the risk of heart attacks and increase the risk of cancers as well. So apart from these myths, so maintaining the proper diet in the form of adequate amount of protein. So why in surgery especially you should the basic concept what we generally see here, especially after practicing for a longer time in South India, is that a lot of people just eat something like a curd rice. They give curd rice so that there are simplified form of digestion. They just give some upma or give one idli and stop it there. No, giving protein is the most important thing for enhanced recovery, enhanced wound healing. So protein intake has to be calculated and given to the patient in the form of egg, in the form of if the patient eats non-vegetarian diet, yes, it should be given chicken. You should avoid red meat. You should avoid food with more oil, more masala and more spices. That is the only thing we say. But people avoid that and they lose a lot of weight. So what happens is, after surgery or for any cancer treatment, the body goes into a mode called catabolism. That means there will be a phase where the muscle needs more protein, the tissues for healing it needs more proteins. Since if we don't provide, we don't replace it with proteins in the diet, then we tend to lose a lot of weight and patient gets more and more sick, and that doesn't recover well from the surgery, especially the cancer surgeries. Thank you very much.